My name is Cheryl Aldridge. I'm 65 years old. I'm from Raleigh, North Carolina, and I'm a patient of Dr. Rao's at Vascular Solutions of North Carolina. I was having issues with my left leg and my left knee, so I went to a pain management doctor who was familiar with Dr. Rao's procedures and referred me to Dr. Rao's of Vascular Solutions of North Carolina for him to check my knee to see if I was eligible for the GAE procedure. My pain was very obvious. My mother is bedridden at home and I'm her caregiver, and my knee would just almost fold in on me when I was trying to take care of my mom, and it was causing me to not be able to do my daily activities that I normally do. But since I've had that procedure, there was no downtime, there was no rehab. It was like a miracle. Dr. Rao told me during procedures, you're gonna be feeling better in 3 days. Well, third day come, I was a little disappointed, but a couple more days came and the pain was like I forgot I even had it. It was so amazing and not invasive. I had no downtime, had not to worry about take time for rehab because my mom needs me and I need to be there for her, and I don't have time to sit down and doctor myself to take care of my mom. Oh, it was bad. I'm not gonna say it was a 10, I'll say more like an 8, because I have been in a 10 before and I wanted to be euthanized when I was in a 10. So it was causing me a lot of discomfort, and I was doing a lot of Voltaren gel and ibuprofen and Tylenol just to manage it. But I was so thankful that Dr. Rao had this procedure available for me and I was eligible for it. I don't take pain medications anymore. I don't like taking pain medications. If I do take a pain medicine, it's not narcotics, because I don't do those. I take things like Tramadol and Tylenol and ibuprofen and Voltaren gel, but I haven't had to take that in a long time now, since the knee procedure. It was probably after the 3rd day of the procedure, because the pain was just like, I forgot I had it. I mean, the pain was just, because it's annoying. Your knee talks to you. It was annoying. And I was having to sit down a lot after do a little task. Well, I got to sit down, but now I'm just going like the road runner. The staff here is excellent. Everybody's so courteous and nice. And when I came in about my knee, they asked me some questions and I filled out some paperwork, and my pain doctor that referred me here had already had an x-ray on my knee to find out it was osteoarthritis causing the pain. So they already had that information, so that made it go a little quicker since I already had recent films that they could look at, and it went very quick. I mean, it was, I don't know, I can't remember exactly, but it was less than 2 weeks, I think, I was in for the knee procedure. It was on a Friday. I had the knee procedure on a Friday, and by, I'd say Thursday, the next Thursday, pain was gone. I'm a person that if I see a task needs to be done, I'm on it. And so nothing was stopping me like, ooh, that hurts, ooh, I gotta stop a minute, ooh, I gotta take it easy. I was back to doing things I need to be doing. I was totally awake during the procedure, but they do give you medication like twilight. You're in a twilight, but you're aware, but you don't feel anything, you don't see anything, because they have the shield in front of you so you can't see what they're doing, but you know they're doing something, but you don't feel anything, and it's not painful. And I believe that I was here maybe an hour. It may have been 2 hours, because you had to have a little recovery time too. And one of the greatest thing that was nice about Dr. Rao's office was the fact that since my husband was in a serious car wreck in June 2020, when a lady texting and driving hit him, broke his C1, C2, paralyzed him one side, they had to put a 3-inch titanium rod in his neck, so now he's not able to drive, and I don't trust him driving in this busy city. It's really crazy way the traffic is. And I was like, I had to stop and think, well, who's going to take me, because I had to have a driver since I was getting some type of sedation. And they said, you don't have to worry, Dr. Rao provides transportation. So I didn't have to have the extra worry about how am I going to get there, how am I going to get home, because their office provided me transportation to that appointment and back home again safely. The nurses were great. They assured me everything was going to be okay. Everybody was nice and friendly. I mean, you just couldn't ask for a better practice and better staff. They're just great. And then they checked on me the next day to make sure I was okay. It was on a Saturday. One of the nurses here called to find out if I was okay, did I have any concerns, was I in pain? And I mean, they did follow-ups with me and checked on me to make sure I was okay. My quality of life has improved dramatically because I am a doer. And like I said, my husband, he's not able to do the things he used to do to help me around the house. So I have to do way more than I used to, plus having been a caregiver for my mom. My quality of life is so much better because I can do the tasks that need to be done. I'm not letting tasks go behind that I used to let go. I said, well, I had a priority list. I had to do what was priority and what could wait had to go on the bottom of the list. Plus I've adopted 3 little dogs I've rescued, and I have 3 little dogs depending on me too, so I'm just a glutton for punishment, I guess. I'm just a caregiver all over. I love dogs. I can't stand to see one have to go to a shelter, and if I hear a story about a poor little dog, he's got a home now. I'm a lot happier now that I don't have to deal with this pain that was pulling me back, setting me back. I don't have any pain now in my knee. It's like I forgot I had it. It's like a past memory. I forgot the pain was even there before. I wasn't afraid of the procedure because after I've had friends that I've known who had the full knee replacement, what they went through was very scary. They had problems. Some of them had to have it done 2 or 3 times. They had to deal with infections. They had a lot of rehab. This procedure did not scare me at all because the staff here assured me, walked me through the process. There's no downtime. There's no rehab to go to. You expect to be back going like you need to be in 3 days, or it took me 5. I was a little slower. Oh, I see them all the time. They still wobble and hobble and still going to rehab, and I'm up. I had no downtime, like I said. I didn't have to go under an invasive procedure. I didn't have to go to a rehab facility for somebody to get me on my feet again and go to rehab for 5 months or whatever. I didn't have to do none of that. This was a very great procedure for those who qualify or are eligible for their knee pain, because I have osteoarthritis. It's funny how people's minds work when it comes to medical, because people have minds, especially the elderly generation, the senior citizens. They have every mind, well, this is the only way. They don't know any other way, but this is the only way. So it's hard to make them understand, hey, there's something new, there's something else, but people are scared of new stuff. If you're suffering with knee pain and you're afraid of total knee replacement or worried about rehab and infections like I was, you need to check into this new procedure that Dr. Rao offers with the GAE, because there's nothing to be afraid of. You don't have to be completely sedated. You're in a twilight zone, and the downtime there's none. And I encourage anyone who's suffering with knee pain, don't stop doing your daily activities and things you enjoy when there's hope and there's help. GAE was the answer for me. I have osteoarthritis, like I said, and a lot of people depend on me, and I need to be there for them, and I can't be held back with a bad knee and being pain and taking pain medicines and pain creams. I need to be there to help I'm a caregiver, and I need to be there to help my family. And I encourage anyone who's suffering with knee pain, reach out to the Vascular Solutions of North Carolina, Dr. Raos, and ask for a consultation and have a clinical visit to let them decide if this is the right thing for you. It was the right thing for me, and I encourage anyone that's suffering from the same thing I was suffering from to please reach out to Vascular Solutions of North Carolina.